Hi, I'm a pharmacist at Parkland Health and Hospital System. Today, I'm going to teach you how to use your insulin pen. There are many different types of insulin pens. It is important that you learn how to use your insulin pen the right way. If you do not use them the right way, your medicines will not work as well as they could. The basic steps for using any insulin pen are the same, and we'll go over in this video. Let me show you different parts of the insulin pen. There's a rubber seal, which is at the end where the pen needle goes. Underneath that, you can see the insulin. The pointer and the dose dial show you how much insulin you are going to inject. The bottom at the end of the pen is used to inject the insulin. It is also important to know about the pen needle. There's an outside cap and a protective seal which covers the entire pen needle. Once you take off the outside cap, there is an inside cap that covers the needle. Screw the needle onto the insulin pens. Before you give yourself your insulin, it is important to have all your supplies ready. Also, remember to wash your hands with warm water and soap and let them dry. With clean hands, take off the cap of the pen. Talk to your healthcare team about whether or not your insulin should be cloudy. If insulin should be cloudy, gently roll it 20 times. Wipe the rubber seal of the insulin pen with an alcohol swab. Pull off the protective seal from a new pen needle, line it up with the pen, and screw the needle on. Do not make the needle too tight. Some needles do not screw onto the pen but push on. Keep it straight as you push it on. After you have put the needle on, take off the outside needle cap and save it. Take off the inside needle cap and throw it away. Before dialing dose, it is important to do a safety test. Dial 2 units on the pen. Remember, each click is 1 unit. Point the pen with the needle facing up to the ceiling and tap on it gently. Push button on the bottom all the way up. If needed, repeat steps 1 through 3 again until you see a drop of insulin come out. If you see a drop of insulin come out, that means that the pen has passed the safety test and you can now dial the right dose. Make sure the window shows 0 and then select dose. You will select the dose by using the dial to turn to the number of units you need. Never force the dose dial when dialing your dose. And never set the dose dial to half units or the pen may jam. When injecting your insulin, remember, move the area where you inject. Do not inject the same place over and over again. Do not inject into scars, wounds, or infections. These are the parts of the body where you can inject insulin. The stomach is the best place for injection. Next, you will clean the place where you're going to inject the insulin with an alcohol swab. Hold the pen so that you can see the dose window. Keep the pen straight. Gently stick the needle all the way into your skin. Then, use your thumb to push the injection button all the way in and slowly count to 10 before taking it out. You may notice that when pushing the button, the dial will go back to the number 0. Let go of the button and pull the needle away from your skin. Let's go over the important parts of injecting your insulin with the 5 keys. Pinch the skin. Put the needle all the way into your skin. Push the button until you see the number 0 on the pin. Pause after injecting and slowly count to 10. Pull the needle straight out. After injecting, put the outside needle cap back on the needle and unscrew or pull the needle off of the pin. Put the pin needle in a sharps container. If you do not have a sharps container, you can use an empty thick plastic container like a bleach bottle. Remember to shut it and tape the lid when full and throw it in the trash. Keep this container where children and pets cannot get into it. Now that we have reviewed the steps on how to use the insulin pen, there are a few important things to remember. First, talk to your healthcare team about whether or not your insulin should be cloudy or clear. Always throw away the pin needle in a sharps container after use. Never use a pin needle more than once. And as for storage, keep pins that you have not started using in the fridge. Store pins that you are using at room temperature. Check to see how long your pin is good for at room temperature. Do not freeze insulin. Keep out of direct sunlight and heat and do not leave in the car. Do not store your insulin pen with the needle on. Put the needle in the insulin pen just before you give your insulin injection. Take the needle off when you are finished your injection. If you have any questions about how to use your insulin pen, please ask your healthcare team.